Hi, this is my response to week three's reading of Dreamland, part 3. As you've probably noticed, there's a big difference in the size of the sections in the book. So what really started off in the first couple weeks as a large chunk of your weekly reading, the sections are gradually getting smaller and smaller and smaller. So they're getting very manageable, and I'm replacing a lot of that time in reading with some very valuable articles, specifically week 4, this week. I have a number of articles you'll be reading on medicated treatment for opioid addiction. But one of the responses, one of the primary responses that I've gotten for this week, part 3 in Dreamland, a lot of students were responding to some of the videos and some of the readings on drug courts and the different ways that they handle addiction and criminal sentencing. I wrote just a tiny bit about this in my response to a lot of those discussion posts, but that's how part 3 really starts off in Dreamland. And here we have Seth Norman, runs the only drug court in America that is physically attached to a long-term residential treatment center. And America is one of the only countries in what's considered, it's not politically correct, but the first world, a modernized country, that criminalizes addiction. And this is very different than criminalizing drug sales, drug dealers. They are criminals. Those drugs end up hurting people, creating addiction, and they should be prosecuted to some degree, depending on the drug, but especially opioids. So when we're thinking about this, if you were to go to Europe, no police officer would see an addict as a criminal. They see addiction as a disease, something that needs to be treated. So I'm not even talking about whether various drugs should be legal or not legal. It's kind of a different mindset in America, wanting to punish people who are addicted to drugs. And once again, yes, a lot of time addiction leads to criminal behavior like stealing, shoplifting, dealing, and that's not what I'm talking about. I'm talking about just the addiction. Slowly, our mindset in America is beginning to change, but there's so much to be considered. Everything from for-profit prisons. What's the true purpose of the old war on drugs? Do people actually profit from the war on drugs? So there's a lot of political questions regarding this, but rather than getting into the politics of it all, one of the things that it says is basically that our view only began to change when the population of the addicted changed. And we've talked about this before, but it changed basically from a minority population or a lower socioeconomic population, combination of that, to basically a middle or upper class white population. And, oh, well, like it says, then it's our neighbors' kids who are dealing with this addiction. And for some reason, that changes the politics and the court sentencing, and, oh, they should have a second chance. Well, you know, how much was bias a part of previous sentencing instead of always trying to find treatment and help for people who have an addiction? And here we see just an example. Seth Norman is one of the pioneers, a judge in Nashville, and struggling for resources, using state and local surplus. And here he did a little thinking. If you just tax every pill, opioid pill, 1 penny, then that would pay for all of the treatment. It's kind of amazing. When we look at a lot of the statistics, we know that prison does more harm than good, and that's because our prisons are very different than prisons in Europe or other first world nations. Their focus is on rehabilitation. Our focus is usually on punishment. They are overcrowded. There's limited resources. But so we have not only a lot of recidivism, people going back to prison after being released, but we also have a lot of relapse with addictions. Most, well, I wouldn't say most, but over 50%, so a majority of individuals in prisons either have an addiction or a diagnosis of some other mental health issue. The rest have a variety of issues, including things like resources in their that were available in their youth, whether it be from they be from lower socioeconomic communities or things like that. But we should be moving to rehabilitation and treatment. The other statistic is basically that it is far less expensive to rehabilitate, to treat addictions, to provide skills and resources, to send to rehab, than to actually keep people in prison. When we look at all of the modern nations in the world, we have the highest number or percentage per population of individuals in prison, which says a lot about how we deal with these issues. So that's the first part. Second part talks about how places, cities basically, and police within those cities change the way they dealt with drug dealers, whether it be to use specific sentencing laws to make it tougher on dealers, or to get more dealers to basically tell who they were working for, or to make it more costly for the criminal organization to function. But they began to change the way that they were dealing with the drug dealers. And then we have apparent soul pain, and it gives us more examples of tragedies, what parents went through when their children were addicted or overdosed or died as a result of this epidemic. I'm looking forward to reading your responses as well. And I just focused on a couple key issues. And there's so much more about these specific issues that we can talk about. We're really just scratching the surface. But I'd like to hear your opinion as well. Thanks a lot.